At one of our recent leadership forums, we asked participants to pick a word that described how they were feeling. And probably not surprising, one of the most common words that was cited was overwhelmed. And I bet every one of you has felt overwhelmed at some point in the recent past. And overwhelmed is different from just being busy, right? We're always busy. But being overwhelmed is when we're busy, and two other things are true. First, we feel like we can't get everything done that we are trying to do, or at least not do them well, and that the consequences of not doing them would be serious. And the second is when we feel like we don't have enough control over what's on our list, that we don't have the ability to choose to prioritize. When we have both of those things, we start to feel overwhelmed. And those conditions are often true in healthcare, right? We have a huge responsibility for the patients that rely on us, patients and families, and the consequences of not doing what we need to for them are really serious. And we don't have total control over things. We're influenced by, for example, the epidemiology of diseases, by the distribution of all the social factors that affect the health outcomes of our patients. And of course, all the regulations that we deal with from third-party payers and government and so on. So it's easy to feel overwhelmed when we're in healthcare, and especially now. We're in a pandemic where everything we've had to do has changed, and our resources are more constrained, and even our normal work is just harder than it needs to be. So I totally get that feeling of overwhelmed. I have felt it myself recently. I felt it in the past. And there was a time in the past when I was feeling particularly overwhelmed when I encountered a book called Essentialism. And it was written by a guy named Greg McCune. And the concept of essentialism really helped me out. Now, at its core, the concept is ridiculously simple. It's not enough to ask if something is important. You have to ask if it's essential, if it's the most important thing, and then you prioritize that. Well, I think we all know we need to prioritize. The idea that somebody gets paid book royalties or speaking fees for saying you need to prioritize seems kind of silly. It's not the core concept. It's that it provides a framework and a set of tools for how do we do it. Because I think we all know that at some point we need to prioritize, but we all struggle with doing it, both as individuals and as groups. So the core concept of this is, or one of the core concepts, is that one of the things that often gets in the way of prioritizing when we know we need to is that a lot of what we do is good and important work. So the situation I was in was I had just assumed a job as Chief Operating Officer at Children's Hospital Wisconsin. But I also had my research activities I was still doing, and my teaching and publishing and professional societies and my clinical practice. And they were all important. So it was really hard for me, and I was struggling. I didn't feel like I was doing any of them well. So there are two things that he points out in this book, two ways to get past that conundrum that really resonated that I want to point out. The first is the idea of using extreme criteria. It's not enough to ask, is something important? You have to ask, is it most important? Is it essential? And the way he frames it up is, it's not enough to ask yes or no, should I do it? It's that if it's not a hell yes, then it should be a no. And when I looked at my list of activities, they were all a yes. I liked all of them. I thought they were all important. But some of them weren't a hell yes, and that enabled me to let go of those. The second thing that he points out, in addition to using extreme criteria, is we tend to focus on what we have to give up. If there's something that we like or we think is important and we stop doing it, we focus on the fact that we have to give it up. Rather than focusing on giving it up, focus on what we get to go big on. Because we know that if we're trying to do too much, we're not going to do any of them well. And that's what gets us overwhelmed. If we stop doing something, we can shift our attention and focus and resources to doing something else, and we can do it really well. We can hit it out of the park. It's a way of giving ourselves permission to give up something that we might really like. For me, that was my clinical practice. I had practiced pediatric emergency medicine for 24 years. And I estimate that during that time, I probably saw close to 40,000 patients. And that was really meaningful, important, joy-bringing work. But I also knew that if I was going to continue to do enough of that to maintain my skills, it was going to get in the way of doing my new job. And rather than focusing on having to give up my clinical practice, I instead focused on being able to do a really good job of running the hospital. It was a way of giving myself permission to let go of that. And it's not that I don't miss it, I do, but I don't regret it. Now I get that we're not always asking ourselves for permission. Sometimes we need to ask other people for permission to give something up. But it's important to have that conversation, and for us as individuals, as teams, and as an organization, as Children's Minnesota, to think about that. As we think about how do we deal with the aftermath of COVID-19, how are we going to move forward and get ourselves out of this sense of being overwhelmed, we need to ask ourselves those questions. We need to ask not what's important, but what's most important, what's essential for us. And it's right there in our vision statement. We want to be every family's essential partner in raising healthier children. So we need to think about what are the things that we're doing that are essential, that only we can do best. What are the things that are a hell yes? And then we need to focus on those. And rather than focusing on things that we might not do, focus instead on being able to do those things that are essential for our patients and families and really hit those out of the park.